Okay, today we are diving into a scientific achievement that honestly sounds like it's been pulled straight out of a movie. We're talking about a cure for a specific kind of deafness, and the story of how they did it is just incredible. I mean, just listen to that. We just got a cure for deafness using a single injection. That's the almost unbelievable statement at the heart of this whole thing. It's not a dream, it's a reality, and we're going to break down exactly how scientists pulled it off. So, let's get into it. To really wrap your head around how huge this is, we first have to look at what came before it. For a long, long time, the go-to option for many people born deaf has been the cochlear implant. Now, don't get me wrong, these devices are amazing pieces of tech, but they are surgically fitted and they work by approximating the sensation of sound. It's not natural hearing. What we're talking about today, this is something else entirely. To really appreciate this incredible solution, you have to understand the problem at its very core. And the issue isn't actually with the physical parts of the ear, but with one tiny crucial instruction in our genetic code. And it all comes down to this one thing, the OTOF gene. You can think of this gene like a manager on a factory floor. Its whole job is to order the production of a super important protein called otoferlin. If you don't have otoferlin, well, the entire hearing process just grinds to a halt. And this right here shows you exactly where the breakdown happens. So step 1, step 2, they work perfectly fine. Sound waves come in, these tiny little hair cells in the inner ear bend just like they're supposed to. But then, bam, we hit a brick wall at step 3, total failure. Because the OTOF gene is faulty, there's no otoferlin protein to act as the spark. And that means step 4, sending the signal to the brain never even happens. The message just disappears. The chain is completely broken. So you see the problem, right? A single bad gene means a missing protein. The solution then isn't about creating a workaround. It's about going in and actually fixing the source code itself. And how they did it is it's an incredibly clever piece of biological engineering. This really lays it out perfectly. On the left, you have the cochlear implant, which is essentially a bypass. It jumps over the broken biological part to create a sensation of sound. But look at the gene therapy on the right. This isn't a bypass, it's a fix. It actually repairs the broken machinery so the natural hearing process can finally work the way it was designed to. So how on earth did they do it? Well, researchers came up with this brilliant 6-step process. First, they built a perfectly working copy of the OTOF gene. The only problem? It was too big to fit inside a normal delivery system. So, and this is genius, they split it in half. They put each half inside its own harmless virus. Think of them like 2 little delivery drones. Both drones were sent off in a single injection. Once they got inside the right hair cells, the 2 pieces of the gene found each other and clicked back together, creating the full working instruction. And just like that, the cells turned back into otoferlin factories and the signal was back online. Okay, this is where things get really wild. We've talked about the theory, we've seen the elegant science, but what did this actually do for the patients? The results are nothing short of astonishing. Just look at these numbers. Before this therapy, the quietest sound the patients could hear was around 106 decibels. To give you some context, that's as loud as a chainsaw running right next to you. They were profoundly deaf. But after the therapy, that number dropped all the way down to 52 decibels. That is the level of a normal conversation. It's not just an improvement, it's a completely life-changing difference. Now, it's important to note this change didn't happen overnight. It actually took several months, and that's because it wasn't just about fixing the hardware in the ear. The patient's brains, which had never processed these kinds of signals before, literally had to rewire themselves to learn how to interpret this new world of natural sound. The success here is obviously incredible for the people involved, but the implications are so much bigger than just this one condition. This trial really signals a major shift in how we might treat all kinds of genetic diseases in the future. What we're really seeing here is a successful proof of concept. This could be the dawn of a new era for treating other types of hereditary deafness. And even bigger than that, it provides a working blueprint for researchers to tackle a whole range of other genetic conditions. This is the future of medicine, this rise of personalized, gene-specific treatments, and it's happening right now. So it kind of leaves you with this one big thought. A single faulty gene, a tiny missing protein, and an engineered virus carrying the fix? It really makes you wonder, what if the biggest, most world-changing breakthroughs in medicine don't come from giant machines, but from the absolute smallest of packages, designed to repair our very own code?